So, just how is everybody? We haven't seen you guys in a while, and we are just super, super excited today to come to you. And we have got a superstar from our functional medicine program, has graduated recently, Lesley Allen. Hi, Lesley.
Hello.
So good to see you, and so looking forward to hearing more about just where you're at the moment. So, yeah, how have you been?
I've been great. So busy, but that's a good thing. Or I should say productive. I'm trying not to say busy, but productive.
Yeah, busy and productive, two different words nowadays. But
right.
Yeah, just really good to see. And yeah, maybe let's just start off simply, and maybe you just want to let the viewers know a little bit about your background, where do you practice, and what is your setup looking like?
Okay, excellent. So I practice in Kentucky in a small town called PYT Valley, and I own a holistic center here, and I practice part insurance-based physical therapy, and then I also have a cash-based portion of my business, which is medical therapeutic yoga, Ayurveda, and now functional medicine. And then I also have a Pilates instructor that teaches Pilates as well.
Fantastic. And it's just yourself in the practice? Or you have other people working there before?
Just myself. So as I say, well, and you know, my husband is my IT guy, my maintenance person, my accountant. But no, I'm just a solo practice. I try to keep everything as simple as possible, low overhead, and then that way I can spend more quality time with my patients, and I don't have to see as many patients just to pay overhead.
So you're a busy solo practice in Kentucky. And
yes.
So tell us a little bit about that kind of lifestyle at that point of view. You know, how did you feel? What was your normal day like in that busy solo practice with a family?
Yes. You know, I see my patients for 1 hour, but for instance, like today I've seen, you know, I started at 7 a.m. and I finished at 5, and one patient after another. It's, you know, just basically a per hour pay. And then I have my cash-based classes that I'm doing in the evenings. And then like tomorrow I'll teach two group yoga classes. So I kind of graduate my patients to my group classes.
Okay, good. And you got a lot of after hours work, or did you kind of cut off at the end of the day?
I try. So for the first 2 years of my practice, I pretty much worked 24/7. And then I try my hardest, but I made a commitment to my family that I will work when I'm at work and I'll be present when I'm at home. I try to do that as much as possible, but it doesn't always work out that way. So like today, I've still got probably 3 or 4 patients to document.
Got it. So typical busy solo practice, we're working 24/7, and I can completely relate. I was in that same situation, and it's love your profession, but it is quite consuming on the whole.
Right.
So how's your kind of health been related to your busy profession along the way?
Well, that's a loaded question, because I left a busy schedule, and then as I transitioned into my business, it got even busier. But yes, my health on a whole has been better over the last 2 years, but that was because of functional medicine. So that was where I really, and again, I do a lot of stress management within my business practice. So I'm meditating with my patients. So I think that has helped me tremendously. But my health definitely from prior to that was greatly impacted by stress and the fast-paced schedule.
Oh, that's awesome. And thanks for sharing that. I know it can be quite personal, but a lot of us as PTs, we go through that where there's a lot of stress. We're in that health profession, and we see our own health kind of taking a back step along the way. And then you're mentioning that you actually went through functional medicine, and is that how you first was aware of functional medicine?
Yes. So it was with my health issues, I quickly recognized that Western medicine or conventional medicine was not going to work out for me. You know, I was seeing two different providers. My primary care was only managing the symptoms of my autoimmunity, and my dermatologist was managing a skin condition. And it was when she tried to prescribe me a cream that had a black box warning of a carcinogen, a known carcinogen labeled on it, that there was no way that I could continue with that. So that's when I started to search for other alternatives. And I tried to go down the path of like naturopath, but then they were so limited in the lab work that they could do and things like that. And that's where I ended up finding a functional medicine doctor and started to explore that.
Okay, so, and you saw changes quite rapidly once you started implementing the plan of care there.
Yes, I did. And now I've questioned a lot of what I've gone through with my functional medicine, but at the same rate, yes, it was by far much better. And I think it was because of the extensive lab work, and two, someone sitting down with me and looking at the whole picture and not just looking at a diagnosis and then trying to prescribe a medicine. I really wanted someone to figure out, and no one was addressing autoimmunity. They were only addressing a thyroid condition and vitiligo, and that was it.
Got it. Okay. So you went through that experience personally. How did that impact your practice then? Did you make any changes or recommendations or referrals, or what? Did you see your patients with new eyes?
Yes, totally. So I definitely implemented a lot of what I learned, because the majority of my patients that walk through the door have chronic conditions. So they're the ones that have gone through the system, a traditional physical therapy clinic, but they have like chronic pain issues. And so they did not get better, essentially. So fibromyalgia, different things like that. So even PTs referred to me, and it's usually the patients that they don't necessarily know what to do with. And so that's who I tend to get. So I started to implement, which I already did, a lot of the gut health education. I was already implementing that into my practice, stress management, all of the lifestyle modifications I was implementing in. But for the other ones that really wanted to take it to the next level, I was referring out probably around at least 6 patients per month to my functional medicine doctor.
Right. Okay. So 6 patients. So you were managing a few, and then you had to outsource. And why were you outsourcing? Was it just you didn't have the knowledge, or what was the?
Well, just for the additional testing. This was before I realized that PTs could do functional medicine. So for people that were stuck like I was stuck. So before I was aware that I could actually start implementing some of these things, that's when I was transitioning them to him.
Got it. So, okay. So you had already been, so we see a lot of physios nowadays that have just heard about functional medicine yesterday, but you had some history with yourself, introducing it to your patients, and that brought you to a point. So you felt like there was still something missing there, and then is that why you started looking at how to upskill?
Well, it was January of this year when I was just trying to think about, okay, where's my practice going? What are my goals for the year? And honestly, when I saw your program, it was just like, this is it. This is what I need to look into. And honestly, with the realization that physios could implement this into our practice, that's when it was a no-brainer.
Got it. So You've been through a 12-week program in functional medicine, which often takes people years to get their heads around. I mean, you've really fast-tracked into this world. How does that make you feel that you've kind of just stormed into this world?
It's awesome. It's awesome because, one, I don't necessarily have time for a long program right now. I want something that I can take information, and I think the way that you set it up was just like you're taking a patient through a program. So we could be our own patients, our husbands could be our own patients, we could get patients and take them through the process. And so even though there's so much that obviously I am still learning with the process, and I'll go on to learn for many more years, forever probably, but I love that it was concise. I was actually speaking with another friend who has my background in as a professional yoga therapist certification, and she's in a different program, and she's like, I'm not getting, like, she's chomping at the bit because she's not getting the information fast enough. And so that's how I liked, like you set it up, from gut health, you know, the things that you want to address first with your clients, and it just made sense.
Fantastic. So now, what have been the changes in your practice from before implementing the systemized approach with functional medicine that we go through in the program? How has that changed your approach to patient and seeing patients in a different light?
So I guess my approach that is different is during the eval, I'm usually introducing functional medicine to them and what that can do for them and what that looks like, and that we're going to go through physical therapy program, which hopefully is a shorter time frame, and then get them into a group class, which is a more affordable setting, because most clients now have such a high deductible that it's like they're basically paying out of pocket for their physical therapy services, a lot that I see. And so then I can funnel them into as functional medicine patients into a program, like a 16-week program.
Okay, so you using packages and programs the way we suggest in the program to get better outcomes and create better support along the way. How has this changed your financial structure in your practice?
Greatly, definitely. So, you know, I mean, most physios know, you know, hourly rate of what insurance pays. And I did see some cash patients as well, but I mean, it's greatly changed it based on what I can charge for my 16-week program. So if I have, you know, one new functional medicine patient come in per week, that's probably more or just as much as I would make treating 20 patients that week.
So there's been a big change there. Just tell us a little bit about where do you kind of see the future going, as far as how do you want to develop that and change your lifestyle, your structure in your practice to fulfill your life and business goals together for more balance?
Okay. So my ultimate plan is to hire out my physical therapy, and then I will just see functional medicine clients, and whether I can do that, you know, I'll leave it up to them. Like, I have a 14-year-old client right now, and for her mom to pull her out of school to come see me is just not ideal. So she and I have set up, you know, where we're going to do FaceTime or Zoom calls, but, you know, working significantly fewer hours and making more money and then hiring out my physical therapy portion and paying that person well to then market themselves and hopefully give them control over that aspect.
Got it. So your practice is still running. You've got a great flow. That's where the funnel of your patients are coming through. but now you're able to almost see fewer patients, treat them at a higher level, and be able to charge a lot more than you were before because you're getting results that nobody else was. Is that kind of a fair sum up?
That's it. Yes.
Fantastic. Fantastic. That's great to hear. And to really do that within a 4-month period, you've implemented that within that window period. So it's been a rapid change in a practice from a financial structure, patient outcomes, and it sounds like you're so busy you're not too sure what to do.
Right. Exactly.
Fantastic. What did you find the most challenging part on taking on new information like functional medicine is?
Well, I'm kind of an information junkie, so I loved the information. Probably the first, I would say maybe the first genetics, lecture was like my head was spinning, taking me back to the biology days. That was probably the most challenging, but for the most part, I just, I felt like it was doable to keep up with it week by week.
Fantastic. So although it was 12 weeks, pretty intense coaching and mentoring, it wasn't pace that you had a hose pipe down your throat.
Right.
So you had a busy practice, but you could bring in that new information and remodel your practice at the same time.
Yes.
Got it. Okay. So can you tell us just a little bit of maybe a few examples of what you've already implemented with your patients in functional medicine, or results that you've seen with your own health or with patients? Any examples on that level that you've seen?
Well, I'll first just start with myself, since I did have experience with functional medicine in the past, and I've been, on a pretty strict eating protocol for at least 2 to 3 years, and taking supplements. And I've had my autoimmunity under control, but really did not go all the way back to the true root of my problem, which was my gut health. And so when I did my own timeline and my own matrix, it was like, again, that aha moment of like, oh my goodness, I'm not doing enough to address my gut health. And I think that I had gut permeability since I was 8. And then on top of it, switching my supplements to the brand that you recommend, the Zymogen, it's made all the difference in the world. So definitely still taking a food first approach. And I think that that's where some functional medicine doctors, and from what I've talked with other people about in terms of their approach, that they still kind of are, here are your symptoms and then here are your supplements, instead of really going through. I never had someone take me through and show me exactly what I should be doing for an elimination plan. I was just told to go and do an elimination diet, and not even for X number of days, or how to reintroduce foods. I wasn't given any of that information. And so I think that that has been like so eye-opening to me. And then in terms of my clients, some have had very similar situations because they were seeing a different functional medicine doctor, and now they're seeing me, and it's like to really look and analyze the gut. And some had parasites, or some had, gut dysbiosis, and to be able to get that regulated has made them feel so much better.
That's awesome to hear. Can you share maybe a little bit with us on the specifics and timeline on what changes you felt when you did some of the major changes that you've shared with me in the past?
Mm-hmm. In terms of my health, is that what you're referring to?
Yeah, and how quickly it changed.
Oh, yes. So I think it was like literally within the first week. So by week 2, I was already feeling so much different with the changes.
And what different did you feel? What was the symptom changes?
So mainly joint pain. I typically have global inflammation. Inflammation has always been my issue, and oxidative stress. But like immediately the small joints, you know, my neck pain, my muscular pain, my hand pain, all of that was gone.
Isn't that amazing? Hey?
Yeah.
In a week. So
right.
It is fantastic. And yeah, I mean, that's what we call working on the pivotal area for you. And right. You just adopted it so well. So, right. And I think that is the key. So maybe just our last question. I think you've really given just a great story and just how things can change so rapidly from one point to another. What advice would you give anyone who has realized that there's something missing in their skill set and they need to find something else? What would be your advice to them?
I would say mainly as physical therapists, we have so much to offer because we are developing such great relationships with our patients. We're touching them, we're making them feel better with their pain. But the one thing that I knew was missing for me was before I went with a holistic approach was more of that lifestyle modifications, but also, you know, psycho-emotional, and really looking at the person as a whole. And so then to take it one step further and be able to do lab work to really stop guessing about what people's problems are and see each of their issues on a much greater scale, and then be able to address it from an inflammation, oxidative stress, genetic, you know, environmental standpoint. I think we as physical therapists have so much to offer in that way.
Absolutely. Which patient types do you feel that you're seeing are like really great functional medicine patients in a PT practice?
So really any of my chronic arthritic pain, I would say everybody, but I mean, truly, like, because I think that that's what I see so often. I mean, I have a 14-year-old who is an athlete, and I'm seeing her basically due to endocrine disruption and so I mean, that's one example. Another example is fibromyalgia. They will be just amazing. Rheumatoid arthritis. You know, I have a lady with past medical history of breast cancer, and although she's been clear of the cancer for 2 years, she still has that fear. So any ache or pain, especially in her chest area, it's just that triggers kind of a post-traumatic stress symptom in her. And so I think she would just be fabulous for functional medicine. But really, I mean, I have so many, even people that have weight issues, to look at them. You know, you can treat their joint pain all day long, but if you don't address what the true problem is and get them on a program that allows you to specifically prescribe the exercise and an eating program, then you're not really going to take care of the problem.
Absolutely. Well, Lesley, I think you've just done absolutely superbly. I'm so proud of where you've come in, 3.5 months. It's unbelievable. And the joy is you're changing so many lives. Just in your community there alone, I know so many people are reaching out to you. And that's really what health profession is about. We've got to get out there, change lives, serve our patients at the highest level, and do it with the most integrity. So well done to you. And thank you so much for sharing your story with us on your journey through time now, and we're just looking so forward to working more with you to your future goals. So thanks again, and just to everybody out there, if you want more information, please go to www.functionalmedicinefasttrack.com, or the shortened version of that is www.fm-ft.com. So thanks, Lesley. Really appreciate your time, and looking forward to catching up with you soon.
Awesome. Thank you, Garric.
Take care. Bye then.
Bye, everyone.